welcome. Okay, I think we'll go ahead and get started. We good with the Zoom? Yeah, our online folks? Okay, welcome everyone to our Fort Collins Community Town Hall on Colorado's new paid family leave program. As I mentioned, we do have a number of folks joining online. So when we get to the Q&A, we'll probably toggle back and forth between questions in the room and online questions. I'm Cher Hovland. I'm the Deputy Executive Director and Chief Communications Officer for the Department of Labor and Employment. And joining me today are a number of our subject matter experts. We have Chrissy Hall here. She's going to share the presentation responsibilities with me. Joining online, we have Tracy Marshall. She's the Division Director for Family. We've got our comms team. We've got our wonderful people here in the county. I'm going to forget somebody if I name all the names, but Gabe is here in the room. He's our tech support. So we're really excited to be back into the community. Last year, we held a series of town halls. The focus last year was really on outreach to employers to help educate our employer community on requirements with this brand new regulatory division that we're housing at the department. Now our focus is pivoted a little bit into benefits administration, which will start in January of next year. So we'll talk about the circumstances that some might qualify for family. We'll talk a little bit about premium collection. We'll talk about healthcare providers and the opportunities for healthcare providers to interact with the system, with what that looks like. But most importantly, we'll leave time for your questions at the end. Did I catch all the housekeeping rules? Okay, so for folks on Zoom, if you can use Q&A for your questions, and as I said, we'll go back and forth between questions in the room, questions on Zoom. This is being recorded. Also, we do have a reporter from the Coloradan in the room, Pat. Hi, Pat. She'd love to talk to you if you have a story to share. If you have a complaint, go ahead and talk to Pat. Not about the Coloradan, about us, not about us. So real quick, we'll talk about the history of this program. Again, circumstances under which somebody can be eligible for the program. We'll go over timelines for implementation, healthcare provider engagement opportunities, and then open it up to your questions. So this was, as you all may or may not recall, a voter-approved ballot initiative passed in November of 2020, approved by 57% of Colorado voters. Within the Department of Labor and Employment, this is now our 7th division. We are largely regulatory in nature. So if you're familiar with our unemployment insurance program, we've mirrored this very similar with regard to how employers are paying their premiums, filing wage reports. Now, keeping in mind, there are two totally separate benefit systems. So eligibility for one may negate eligibility for the other. We also house workers' compensation. So you will have an instance where you as an individual or one of your employees may be on one benefit program and may look for eligibility for the other. So we'll talk, I think, a little bit about the intersection of other benefit types. But let's talk about kind of what is family. So it's, as I said, a voter-approved ballot initiative. At the time, and I think still today, we are the only voter-approved program in the country. I think there are around just over a dozen or so programs. We're pretty unique in that, number one, we were approved by the voters. And so that has presented some challenges with regard to how the architects of the ballot initiative wrote the ballot initiative. So last year, again, our focus was on employers, and we've made a lot of progress since then. And we'll go over the timeline of implementation on how we got to where we are today. So the program will cover most workers, and there is an opportunity for self-employed individuals to participate as well. The only exemption, which we don't really like to call exemption, maybe a carve out, is for local governments. So local governments were able to vote to either participate in the program or not. However, local government employees do have an option to participate, just like self-employed workers have a chance to participate. Let's see. So the premiums are set at 0.9%. This is a shared contribution from both the employee and the employer at 0.45%. Certainly an employer may cover the full 0.9 if they choose to, but really the requirement is that an employer is responsible for half of the contribution, and that's also equal for the employee. Now that premium rate is actually capped statutorily, but the division director can raise that to 1.2%. Similar to the unemployment insurance trust fund, we take a snapshot of the fund and determine its health each year. So let's say we start paying benefits next year. We'll look at the health and the solvency of the fund, and that cap may go up or down. But previous experience has shown that premiums actually decrease in other states that have had established paid family leave programs. Okay, so what are the life events that qualify someone for FAMLI? We do typically think about birth of a child, caring for a child. Yes, that is one circumstance under which you'd be eligible. Also, within our ballot, it's preparing for military deployment, caring for one's family member or loved one. Also addressing the immediate needs of an individual when there's a threat of domestic violence. I don't believe every program has that provision. I think maybe one or two others, maybe we're the only one. Right. Kind of the leader. Yeah. So that is, you know, when we've been presenting to employers over the last year, we often hear, well, I have a very robust leave plan in place, and be that as it may, and that's great. We love to hear that. That one component of eligibility is pretty unique. So you won't really see any short-term disability or any other leave programs that really have that inclusion in the circumstances for eligibility. So with that, I think I'm going to turn it over to my colleague, Tracy, who's joining us by phone. Tracy, take it away.
Thank you so much, Cher. Appreciate that. Here you can see on your screens, this is our high-level overview of the processes that we're going through to implement FAMLI for you. We began building out our benefits system, and we recently launched the healthcare provider portal of the benefits system. And we'll talk more in depth about that here in a minute. In October, we'll be reaching the first deadline for employers to apply to get approval so that they can use a private insurance plan to cover the same or greater benefits as the FAMLI's state program. Approved employers will get issued a refund for any premiums paid earlier in the year, again, if they meet that October deadline. In November, we'll be launching our benefits system, which will allow Colorado workers to apply for anticipated leave. And then we'll begin issuing those payments for those folks that have been approved for leave in January of next year. This next slide will show you the payments that FAMLI beneficiaries can expect to receive. You can see a few examples of what the premium deductions look like and also what benefit payments will look like based on the employee's wages. When taking eligible family leave, employees may receive up to 90% of their wages, and that is based on a sliding scale. Currently, benefits are capped at $1,100 per week. That cap is proportional to the average weekly wage for Colorado, and it may increase over time. We do have a benefit calculator on our website, which will help families get a rough estimate both of their deductions and what their eventual benefit payments may be if they need to take leave. If you have health insurance through your employer, you can certainly keep those healthcare benefits while you're out on family leave, but you will be still responsible for paying your portion of the benefits just as you would while you were working. And just as a final reminder, premiums are paid on wages up to the federal Social Security wage cap. So always bear in mind that number is not set in stone. And as that Social Security cap changes from year to year, the FAMLI wage cap will also change for premiums. I'm going to hand us back into the room now for Chrissy, who is here as our policy expert this evening.
There we go. All right. So one thing that employers and employees are really wanting to know is how much time can an employee take off. The maximum amount that FAMLI provides is 12 weeks within a 12-month period. Employees can take this off in a single block. So a continuous leave, they can take it in an intermittent or reduced leave. So that's working partially. And then taking time off as needed. Each situation is unique. So depending on what your doctor asks for, your healthcare provider, that can change what your leave looks like for you. It can be very individualized. Continuous leave, again, continuous without an interruption. Intermittent and reduced work leaves are sometimes used interchangeably. Reduced work usually means you can have a cap of how many hours you may be able to work during a week, whereas intermittent might be, I need to take off an hour here or there. Please note, though, that benefits are not payable until the individual accumulates at least 8 hours of family or medical leave insurance benefits. So until you reach that 8 hour, if you're taking an intermittent leave, so an hour here or there, you won't receive benefits until you get to at least 8 hours taken off. Your first payment should be made within 2 weeks of your approved claim. And subsequent payments will be made every 2 weeks after that. Okay, so applying for family benefits. Right now, we're still putting the finishing touches on what this portal is going to look like, and how you're going to be able to submit your claim and track your payments. It is set to launch in November. So we talked about benefits coming online in January, and we're getting a lot of questions about how to apply for leaves. Maybe a lot of our questions are coming from those that are expecting children. It's a little bit easier to plan into January for those types of health situations, especially at this point within the year. So we are working on that. We're getting our paperwork all organized so that we can help provide information to individuals that are in that situation, know they're going to be needing time off. And again, as November gets closer, we should be able to provide more information on that. In the future, though, once this information is released, generally the plan is that a claimant can make a planned family leave request 30 days prior to the event or up to 30 days after the event. Of course, this is taking into account that not all medical situations are planned for. Sometimes things happen, and we want to make sure that we're allowing for time for those individuals that may have something that came up unexpectedly. If you are unable to actually fill out the application for yourself, you can designate an individual to fill out that application for you, to make sure that you are receiving those benefits. It is important to note that family benefits will never be issued before the first date of absence. So until you actually take time off, you're not going to receive benefits. So keep your eyes peeled this fall. We're going to have step-by-step directions in videos that are going to be in English and Spanish, and a lot more webinars coming to kind of walk individuals through that process. Okay, deductions. Some of you may have noticed that deductions have already started coming out of your paychecks. I know that's something within our family that I checked for. Is like, okay, are you actually getting deductions taken out of your paycheck? However, there are people that may not see those deductions happening. If you work for the federal government, a railroad, or certain tribal employees, unfortunately, you can't access family benefits. So that's why premiums are not being taken out. The second reason you could be not seeing those premiums being taken out is that your employer is paying that premium for you in full. So you're getting a little extra perk that not everyone is actually receiving. The next, which was mentioned a little bit earlier, is that if you're part of a local government that voted to opt out, those deductions may not be happening. However, it is important to note that employees of a local government can choose to opt in. but it doesn't mean that their employer is actually going to deduct those premiums for them. So again, stay tuned. We'll have more information on how that's going to work coming shortly in this fall. Another reason that you might not see the deductions coming out is that your employer has opted for a private insurance plan. So those payments are actually going to the insurance plan, not to the state. So it wouldn't show up as a family premium. However, if you are not falling into any of those categories, you know that that is not you, but you have not seen these deductions, you might want to ask your employer. Just to make sure that you will be able to access those benefits and there won't be any delay in the event we never received anything from you. So make sure that you're keeping on top of that and looking at those. One question that we are getting a lot has to do with self-employed employers. Your participation is optional. So this could be an individual that has a gig job. So a lot of individuals that we're seeing are Uber drivers, Lyft drivers, Dash, all of the food services that we have come to rely on through COVID. We're seeing a lot of those individuals wanting to know if they can participate in FAMLI, as well as those that have either brick or mortar, Etsy stores, things like that, that might be self-employed, that they are developing their own and bringing in their own income. As I mentioned, your participation is optional. As a self-employed worker, you would only owe the 0.45%, which is a relatively low-cost insurance plan. If you've ever looked for insurance within the field, as a self-employed individual, it's really a lot lower than what a lot of insurance companies are actually offering. There are some caveats with that. You will agree to pay premiums for 3 years if you want to opt in. There's no enrollment period for self-employed workers, and you can opt in at any time and apply for leave once their benefits do become available in 2024. So from self-employed to sole proprietors, we also want to mention small businesses. Sometimes those self-employed individuals have 1 or 2 employees. Or they're a family business. On our website, there's a whole section that talks about small businesses, how FAMLI applies to them. And you can download the small business guide to FAMLI. We have all of the information about how to count employees, including seasonal or part-time workers, and how to tell if an employee or an individual is an employee or an owner. Do you fall into the category of a self-employed individual, or are you actually an employee? So if you're in that situation, please check out that toolkit page. It's on famli.colorado.gov, and it's a great resource. So one of the big questions that we are also getting has to do with how is FAMLI different from FMLA? FMLA is unpaid. You've never had to pay into it. Whereas FAMLI, now we're dealing with premiums. So we're getting questions about how this is going to actually interact with each other. FMLA is a federal leave. FAMLI is a state leave. FMLA is a little more general than what Colorado FAMLI is. It gives workers of companies with 50+ employees the ability to take 12 weeks of unpaid leave for certain life events. And the worker's eligibility is determined by the employer. So there are different factors that play into that don't necessarily play into FAMLI. FAMLI is paid. That's one of the biggest differences between the two. FMLA is unpaid, but job protected leave. FMLA doesn't cover all military deployment situations. And it doesn't cover domestic violence or sexual assault situations unless it leads to a serious health condition as defined by FMO or under FMLA. If you are in a business that is smaller than 50 employees, FMLA is not an option for you, but FAMLI is. So this is far reaching to individuals that may have never had access to a paid leave in their work careers. As we mentioned, with this smaller group being involved, small or self-employed individuals are also eligible for the FAMLI program. They are not eligible under FMLA. So as I mentioned, FMLA offers job protection. FAMLI also offers job protection. However, that benefit doesn't kick in until the employee has worked for the employer for 180 days. However, you can take FAMLI leave at any point. You just might not have the same job protection that you would if you were working for that employer for 180 days. Okay. Job protection means that when you return to work, you should return to your same position or an equivalent position, and your employer cannot penalize you for taking leave. So if you return, you have not worked for your employer for 180 days and you return, there could be changes in your position that would not be protected under FAMLI. Finally, seasonal employee is not required to revive a job that was already scheduled to wind down. That's a huge question that we're getting. Colorado has a lot of seasonal employees. And so we're getting questions about what happens to a seasonal employee whose job no longer exists because they're a ski instructor and there's no longer snow on the ground when they return from leave. So that doesn't necessarily protect your job if the job no longer exists. You can take the time, but there may not be a job for you to return to, and it doesn't guarantee that you're going to have some sort of summer job if you were originally hired as a ski instructor. Okay. So there are a lot of really unique situations that Colorado employees are experiencing right now. And so some of that reinstatement of rights might look a little different for each individual. But we're working to make sure that that's clear for all employers so that we're making this as employer and employer friendly as possible to help support both sides. The FAMLI webpage is a really good resource if you do have questions about how your particular business or employer or situation might apply as far as job protection goes. One of the other questions we're getting is short-term and long-term disability. For short-term disability, if the reason for FAMLI leave also qualifies for short-term or long-term disabilities that are offered by the employer can count both the wage replacement amount and the duration of the FAMLI leave towards the limits included in the short-term and long-term disability policies, as long as they first give notice, written notice to the employees. That being said, sometimes when we're working with disability cases, that might play into workers' compensation. So that leads to another question that we're getting a lot is how does workers' compensation interplay with FAMLI? So FAMLI benefits can not be taken with workers' compensation benefits for the same reason for the absence. Okay, so if someone is absent from work because they're due to a work-related injury, they cannot simultaneously claim FAMLI benefits for the same condition. However, they are still working after the injury or illness and need to take time off for something that's unrelated and is a qualifying issue, then FAMLI benefits can be used. So they can't double dip. Okay. Any condition under workers' compensation umbrella is not eligible for FAMLI benefits. And we're asking applicants to disclose and healthcare providers to disclose this information when they're working on the FAMLI applications. If they do not, then benefits paid to them may be considered overpayments, and they may be disqualified from receiving family benefits in general. I'll turn the time back over to Tracy.
Thanks so much, Chrissy. Appreciate that. All right, so our next slide is showing you our new healthcare provider portal. This is a tool that we've built specifically for our healthcare providers. If there are any healthcare providers that have joined us this evening, we do want to give a quick overview of this new online portal just for you. My Family Plus is the online application system that Coloradans will use to apply for benefits, and it will also allow healthcare providers to support their patients by verifying a patient's claim for family benefits based on their patient's condition or the recommended treatment plan. This portal is just for healthcare providers. It's recently launched, and so far it's working great. Registering directly in the system will allow our healthcare provider partners to provide an elevated patient experience by supporting them and their family members when a serious health condition prevents them from working by getting rid of excess paperwork. Providers can register, verify their license to practice, and add support staff members to access their account and support in managing their patients' claims. Once we open up the system for all Colorado workers later on this year, providers will then be able to verify those claims exceedingly efficiently. All of our healthcare providers in Colorado are going to want to use the portal to help them avoid paperwork and to generally make life easier for their patients who are going through these critical life events. We know that no one goes into medicine or healthcare because they enjoy doing paperwork. So we'll show you a quick glimpse here of how to get started using this portal. Go to our website, famli.colorado.gov, and navigate over to the Healthcare Provider tab. You'll want to click on the button to log into My Family Plus. If you've ever used login.gov, you can use the same account details for My Family Plus. If not, you will need to create an account first, and we've got a separate video on our website that will show you how to do that. We'll also put that link into the chat for those of you online. So that was a quick look at how the portal will appear to healthcare providers. What I also want to show you is the forms and what they will look like if you have a serious health condition and you need a healthcare provider to verify your claim. First of all, you'll be able to log into My Family Plus and search for your provider. If they're in the system, that's great, and you'll be able to do all of this online. If you don't find your provider in our system, you will need to print these forms out and physically bring that copy to your provider's office and have them fill it out for you. On the right side of your screen here, you can see a couple of images. This is just an example, of course, so you can ignore the health conditions that we're mentioning here. But essentially, your provider will describe your health condition. They'll give their recommendation on whether or not you need to take time away from work. Medical professionals will also be using the codes, the ICD-10 codes, that they regularly use anyway to communicate with other healthcare professionals related to the conditions that they're treating. This is not anything new that your healthcare provider would struggle in providing for you. If you don't know whether your doctor is planning on registering the system, just ask them next time you see them, and if they're familiar with the FAMLI program. We do have flyers you can give to them, and there's some of those in the room for those of you in person. They've also got QR codes on them to try and keep it easy and simple. And just remember, nobody really wants to do paperwork when they're facing one of these serious life events. So any help you could give to us as far as encouraging healthcare providers to register would certainly be appreciated. I'm going to hand you back over to Cher in the room.
Thanks, Tracy. Okay, we've had a lot of questions coming in online that our folks have answered, but I want to pick out a few for the benefit of the folks in the room, but let's start with a question in the room. Yes.
Oh, yeah. So, I had a question I saw, for, caring for a newborn child. If I take my 12 weeks of FMLA off in 2023, am I still eligible to take 12 weeks, in 2024? Because my employer's a little confused on that.
The answer is yes, but I'll let one of our online folks or Chrissy, if you want to respond.
Come to the mic so they can hear me. Yes, you can. This is probably going to be the only time that this is actually available. But yes, you can take 12 weeks of FMLA and then in 2022. And as long as you're within that 1 year, so up until that baby's first birthday, you can still take family in 2024.
Just to add, as long as your employer is contributing on your behalf as you are, so without the other exemptions, local govs and private plan, then yes.
Correct.
Another question?
Yep, just for 2024, because benefits are not available until January 1, 2024. So there might be some circumstances where a healthcare situation or a health condition might actually start prior. Someone might be on FMLA or might have used their FMLA already. So this, as benefits start, we're going to see a little bit of gray area with that. That's a great question.
Jessica, do you want to take an online question?
Sure, we'll take an online question next, and I think Sherry, you can answer this one. The question is from an employer asking for more information about the refund process once they have a private plan approved. Will Family be posting additional FAQs on the premium refund process for payroll and HR professionals to reference?
The answer is yes. We have just now begun to implement the process for requesting a refund. And just as a reminder, anybody who paid into the fund and then later secured a private plan will be eligible for a refund for premiums paid. And so it's we're looking at it in two phases. One is we will proactively reach out to employers who have secured a private plan. And I don't remember how many employers we have who have approved private plans, somewhere around less than 200, I think.
I think it's around 200. Yeah.
So one is the division will reach out to those employers, and part two is there's also a process to request that online. Did I reverse those in order, or are those about the same?
They're the same. Yeah. So if you visit our private plan page on our website, basically the process right now is you can give us a call to initiate the refund process, and we'll start processing those in mid-September. And then for any employers that get their private plan approved after that, the process will begin automatically, and we'll reach out to you to start that refund process. The other piece of it is if the employer who has the approved private plan needs to refund employees who are no longer with the company, the family division will take that refund and give it directly to the employee. So we'll have to reach out to the employee to give them back those funds. Yeah. Can you get the mic to her?
Why would you refund the employee that left if their bank of family dollars follows them from employer to employer?
That's a great question. Tracy, Marshall, or Chrissy?
Don't have an answer for that one. That is a great question, though.
Tracy, do you have the answer to that?
So not all employers are covered by this. The worker may be going to an employer that has a private plan, and that's not something that we can predict. So that's why those funds would be returned in that instance to the employer.
Speaks to portability, right? Yeah.
It
Good
does.
question at the back.
We'll take another question in the room here.
This is just a follow-up to the FMLA taken like this year for a baby versus, and then again, how does that work if like my employer uses short-term disability to cover a maternity leave, but then that can also be used, like they might require it? How does that work with employers?
So some of that top off, which is where short-term disability might come into that situation. Top off is an agreement that both the employee and the employer have to agree to. When we're talking about disability, one of the aspects of disability is you have to have a qualifying health condition. And unfortunately, a lot of disability programs don't consider bonding as part of a health condition. So if it is after you've taken FMLA, there's a chance that that disability program won't actually consider what would be covered under family as a health condition. So that might be something that you want to factor in with that decision, that you would still receive family benefits. You just might not receive a top off from your employer at that point. So you would still be eligible for family leave. Yeah. So those are separate as far as qualifying for a short-term disability benefit versus family. You would still qualify for a family situation. But you just might not receive a top off through short-term disability like you may receive payment during your FMLA leave. So yeah, you would still be qualified. You'd still qualify, so apply if that's what you want.
Jessica, oh, I'm sorry.
I have two questions. I think the first builds off of that. I think I heard you say that someone who has a baby in 2023 is eligible for up to 12 months. I think I heard you say till the child turns 1. So if the baby was born in February of 2023, would that mean there's only 1 month of coverage in 2024? Just to clarify. Okay.
Yep. That's the statute of limitations essentially for that health situation, is that up until, just like FMLA, up until that baby turns 1, you can still apply for benefits. So if your baby was born January 15th, you could receive benefits up until January 15th of 2024 if it was born in 2022.
And then my second question, for healthcare providers and registering for the portal, am I hearing that it's voluntary?
Yes.
It's not mandated right now?
Yes.
Okay, thank you.
I guess we just wanted a little more clarification on like the maximum amounts with short-term payout in conjunction with family, like how you figure.
So any sort of short-term disability, short-term or long-term disability payments are going to be handled based on your provider. You're actually getting insurance through. Family benefit is separate. So we won't necessarily look at who your carrier is. You will just be able to receive benefits. Your employer is the one that might limit that, or the insurance carrier might actually limit that if they find out that you have applied for family benefits. So they might not pay out the total, whether it's 60%, whatever your plan is, the 60% if you're receiving 80% from family, depending on your situation. So there are going to be some limits there, but as far as your ability to qualify for family, it is separate from your ability to qualify for short-term or long-term disability.
And then it can't equal more than 100% of your pay between the two.
Yes.
Essentially.
Yeah.
So if they have 67% coverage for short-term or whatever, then family will cover the rest, or vice versa.
Family is generally going to come first in that situation. The only time family won't come first would be a workers' compensation or potentially an unemployment situation.
And family would cover up to 90%.
Up to 90%.
So then short-term could cover just the rest.
Yep.
But we don't necessarily, like, do we have to notify? So we're the employer here.
Yeah.
Do we need to notify short-term that they have that plan? Like, that's what I'm not sure the communication,
absolutely.
How that works.
I would definitely reach out to your short-term disability carrier and see what they are going to prefer in that situation.
Okay.
I anticipate that they might start including that aspect on a form.
On the paperwork.
Um,
Yeah, that's what I'm wondering. I'm like, how would they
Yeah.
know, or how would we let them know?
Yeah,
Okay.
but they will likely, especially as this is happening, you might notice if you have a US insurance company that there are different pages based on what state people live in. There might be a caveat for Colorado. So
Okay. And I think
I
there
would-
is something on our form where they have to talk about other income, you know, and
Yes,
stuff
exactly.
like that. So it just might be
it might
an
be
added
something
line
like
for
that.
family or whatever.
Yeah.
Okay.
They'll know what they're getting ready for because they should be working on their
They can
programming
use
for their
both. They just
system.
can't be paid over the
Yep.
100%.
Correct. Great question.
So I'm due in early January. So what I'm trying to figure out is what if I go early?
Yep.
And then how do I go about obviously needing to use short-term disability and FMLA, but then when does family, like when would that kick in then?
So maternity cases are super fun. Which if this isn't your first one, you know that it's completely unpredictable. So if the baby comes early and you qualify for FMLA, you would likely start your leave on FMLA, whatever your employer's disability program is. If there's a waiting period or things like that, it would start at that point. As soon as January 1, 2024 hits, family benefits can start paying out. You can apply for it again as soon as that application process is up and running in our system. And then that could essentially extend your leave over 12 weeks, but it would be 12 weeks of FMLA and 12 weeks of family leave. You might see an issue with, again, depending on your disability insurance, they might not consider post-healing period, which could be 6 to 8 weeks, depending on the type of birth situation that you have. They might not consider that as a qualifying situation. So that bonding time post-healing after giving birth might not qualify under your own disability insurance program. So I would definitely, if you're concerned about that, reach out to them, ask them how long does it usually cover for a maternity situation? Because every plan is a little bit different.
We're going to go to one online question and we'll go back to here in the room.
Okay, we've got a couple questions coming in online about the waiting period. So I'm gonna toss this one over to Tracy. If a qualifying health condition begins within the last 8 days of 2023, would those dates falling during this time be counted towards the 8-day waiting period?
All right, thanks, Jessica. So I think there may be a little bit of confusion. There is no wait period to be eligible for family benefits. So if you have your appendix removed tomorrow, your benefits can start tomorrow. There's not an 8-day wait period. I think some of the confusion may have come from hearing about the intermittent leave process. For intermittent leave, you need to miss at least 8 hours of your workday before we will start mailing out or direct depositing payments. So that's maybe where the number 8 comes in. But again, for family, there is no wait period before you are eligible for your benefits if you become unable to work.
And we'll go back to the room.
Yeah, I was wondering, you described it's a wage replacement program, and then I believe I heard you mention that it also helps pay healthcare benefits up to the federal Social Security cap. Is that what I heard or not correctly?
Tracy, do you want to? Oh, go ahead, Chrissy. Sorry.
So you will still be responsible for whatever benefits you're normally responsible for when you're not on leave. So that might include your health insurance premiums that come out of your paycheck. So that family benefit might be used partially to pay those benefits or to pay other costs. But it in itself does not provide health coverage.
So in other words, whatever you're receiving from your employer would continue. So your employer cannot eliminate your benefits because you're on paid family leave.
Okay, because when I go on unpaid leave, they can take that where I have to pay the full premium, but when I'm on paid leave, I have to pay just my portion. So is what you're saying, I would just still have to pay just my portion?
As I understand it, is that correct, Chrissy? Tracy?
Yep, that
Tracy,
is
let's go
correct.
to
That
Tracy.
is
Thank
correct.
you.
So your
I wanna say it's correct,
employer
but-
your employer will maintain your coverage as it stands now. And so they can't eliminate your healthcare coverage, but you will still need to make the payments on the pieces that you make payments for now. But they will not be able to take away your health insurance coverage.
Thank you.
I'm an employer. I run a small company. I feel like I'm kind of late to the game here. For a very small employer, we have 6 employees. How burdensome will this, can you give me a sense of how burdensome you think administering this will be for a small employer?
Tracy, can you answer that?
Yeah, I'm happy to. So for small employers, so you're not required to make any payments to family as an employer because you do have less than 10 employees. But what we are asking you to do is still collect that 0.45% from your workers and submit that to the state. You'll be submitting that to us once a quarter. You can do that by mailing a check if that's more convenient to you, or you can do it through our automated system, which again, may be your preference and may be easier for you. As far as your staff members needing to take time away from work, we'll take care of the adjudication process. We'll send payments directly to your employees. So when they're not working, you won't need to worry about paying them unless you wish to top up in some way. And we'll also notify you when your employee's leave is expected to end so that you're able to have conversations with them about their safe return to work. Does that help answer your question? I can't give it to you really in hours. It really depends what kind of approach you decide to take.
Well, the word on the street seems to be that that this will be a difficult program to navigate on a small scale, and there's some small employers are being urged by third parties to pay a third party to administer the program for you. Our payroll service, in fact, is offering to do that, and they're for a flat fee of $500 a year, which is a pretty high rate, it seems to me, for a small company like ours. But that would imply that it's going to be a somewhat tortured process. Would you care to comment on that?
Yeah, it's, we're certainly setting this up to take as good a care of our small businesses as large employers are able to take care of themselves, right? So this should not become a significant burden for you. You are certainly welcome to reach out to our call center and we'll walk you through any processes that you'd like us to assist you with. But we really have set this up to be as easy and non-burdensome for both employers and for workers as possible. It's certainly going to be possible for you to be able to maintain your business without needing to outsource this to a third-party administrator if that's your choice.
I guess my follow-up, does your TPA handle all of your unemployment insurance, premium payments, wage reports, and separations?
No, that's all handled for us by our payroll service provider. And for that, and they take care of all of our tax calculations and payments and liabilities and reporting, and cut all the payroll checks. for $75 a month. So suddenly $500 sounds like a substantial amount to charge, unless it really is complicated.
Well, I think as Tracy said, if you have a TPA that is familiar with your premium payments, your premium rates, your payroll, they could certainly, you could talk to them, but for a small employer, I don't imagine it would be an administrative burden such that you wouldn't be able to 4 times a year handle the premium payments, file the wage reports, or your existing TPA could, especially if you have only 6 employees. And you're not required to pay the contributions that employers with 10 or more are required. We're happy to chat with you offline also and give you some additional guidance. Thank you. I had a question about what the process will be. So Jessica, would you like to read the process for filing a claim and timelines?
Sure, Tracy, this one is for you. What is the standard processing time from determination and approval of the claim to when benefits are paid?
So that's a great question. So we'll start taking those claims in, obviously, in November. Nobody will be receiving a leave determination until they actually start taking time away from work, which for most people obviously will be that January 1st date. Our goal is to have those payments out after people have been out from work for 7 to 14 days. Exactly how long the process will take, that's really going to depend on the volume of claims that we receive. But we do have several states that have gone before us, so we have pretty good estimates of the kind of volume of claims we're going to see. And certainly our goal is to get payments out to people within 2 weeks.
Thanks, Tracy. I'm going to take another online question here and hand it over to Chrissy. It has to do with our new definition of wages. The question is, does a minister's housing allowance affect the calculations? Right now, the housing allowance does not get the 0.45% tax.
Okay. This is a great question. I knew one of these was going to come up. So wages, our wage definition, we just adopted a new definition to hopefully clarify what wages are actually subject to family. We were mirroring UI, and UI has a lot of IRS code, which if you've ever done your own taxes can pose some challenges. So our goal was to try and simplify it as much as possible. At this point, our definition is gross wages for services performed by the employee. Okay. That would mean that our post-tax as well. We also highlighted that in just to make sure that was clear. So with the question of housing allowances, housing allowances are only included, lodging is only included if it is used to meet the minimum wage minimum. Otherwise, it would not be included as wages subject to family premiums under that new definition. Yeah.
Thanks, Chrissy. Do we have any more questions in the room?
So I know the first 2 quarters that we reported this year, it was a little cumbersome because we had to manually enter employee names, social security numbers. Is there going to be something in the future that we can upload a spreadsheet, or is it going to make that a little bit easier?
I can take that one. So that functionality is available now. If for some reason that functionality is not functioning the way that you would expect it to, please reach out to us, call our contact center, and we'll help you troubleshoot that. But that functionality is available currently.
Yep, I'll look into it. Thank you.
Thank you.
So it mentioned that if you have to use short-term disability and family concurrently, they have to provide, your employer has to provide a written notice. What is that like timeline of getting that written notice? Like, how long do they have to give you a written notice?
That is a really good question.
Because when I talk to my employer right now, they can't give me any guidance. So I'm just like, how long do I have to wait for them to give me guidance to be able to plan for my maternity leave?
Yeah, no, I completely understand. Right now, there is a bit of a transition period. We don't have anything specified on our side. As far as you need to provide when that application goes in, you need to provide that notice. We are having conversations about maybe providing a little bit more guidance on that, but currently there is nothing that we have that specifies that timeline. Ideally, the insurance company, the disability insurance company, or your employer will give you some sort of advance notice. But technically, under the family statute and regulations, they're not required at this point with any sort of date or time.
Well, and I would just add though, that the benefits portal, is not yet live. So that could be something additional, more clarifying guidance could come through rule as we get closer to deploying the benefits portal and benefit payments in January.
As an employer, I'm just trying to understand if we have employees that file for a claim for a family, at what points are we notified as the employer of the process? And also, does it matter if we've opted in or opted out as an employer? Does that make a difference on the notifications that we receive?
Are you a local government employer
Yes.
that has opted out? Tracy Marshall, can you take that question?
Yeah, if you're a local government employer that has opted out and you have individual employees that have chosen to opt in, then you will receive a notification when that individual chooses to utilize their leave or applies to utilize their leave. The only other thing I would add is, are you coordinating that benefit process? Are you submitting those premiums on behalf of your workers, or are they doing that entirely individually?
Probably we would be doing it on their behalf.
Okay, so then you'll already be in our system, which means it's going to be really easy for us to get those notifications out to you when your employees let us know that they're going to be trying to utilize the leave. So you'll receive those just as any other employer would.
I guess just another quick question on PTO, working with that, are we required to have them use it to get to the 100% or not required to use it? Any rules on that?
It has to be a mutual agreement between the employee and the employer.
Okay.
Yeah.
Okay.
I think we have time for maybe one more question in the room. Oh, two more, and then maybe one online. Go ahead, Zuhair.
I just want to clarify. So for individuals who specifically maternity leaves had a baby in 2023, they're eligible essentially for 24 weeks within the first year. If they took 12 weeks of FMLA, like when their baby was born in August or July, and then they're eligible to have their job be protected to take an additional 12 weeks starting in January 1st.
Yes, depending on how that overlaps, potentially it could be 24 weeks.
Does that also apply for babies born in 2024? Are you going to be eligible for taking 24 weeks as well?
Not necessarily. Your employer can require you to run FMLA and family concurrently.
It's kind of a real one-time lucky timing for those
Yep.
folks that are having their babies now.
I just had a quick question in regards to, I guess you still having a job after. Could you just elaborate on that just a little bit? Because I have an employee that is, I hired that person for a very specific position, at our place. And if that person were to be gone for the 12 weeks, I can't function without that person for 12 weeks. So what happens to me as the employer?
Yeah. Now this is a huge conversation that we have had as a policy team and family of what do we do in this particular situation. So you are more than welcome to hire a temporary person for that 12 weeks. We understand that in that situation, depending on how specialized they are, that may or may not be possible. So there is, you know, the family statute provides that protection. So there's a little bit as far as limitations on what we can do. You can hire a temporary person if that is not a possibility. Really, I think we want to hear if you are in that situation. We want to see how prevalent that situation is. Changing a statute is extremely difficult. It has to go through the legislature, and aspects like that. Based on other states, we're not seeing that happening very often, if at all. So we're kind of hoping that is what happens, but we know that it might. And at this point with our statute and regulations, if you are not able to find a temporary individual to cover that, there isn't a ton that can be done. But we definitely want to know if you're in that situation, because we don't want to put undue stress on employers.
Well, no, and
Chrissy?
oh, I'm so sorry.
Sorry, I just wanted to hop in and just do a reminder of one other thing, right? So you will not be paying any wages to that employee while they're out for those 12 weeks. So there will be that additional revenue that you have available to you, whether or not that's in some way able to be funneled towards potential overtime, or whether you can try and upskill any of your staff if you can anticipate this individual needing to go out on leave. So that's also an option if you're able to, again, maybe upskill some workers.
So you would have those extra funds because we would be paying the family benefits.
Okay. So if that, I guess, employee were to come back, would I be able to move them to a different position so they would still have their employment with the company while I did hire somebody else to fulfill that absence? Or do they have to come back to the exact same position?
They need to come back to a commensurate position, right? You can't downgrade, downskill, or reduce their pay. So they would need to be able to come back to something of equal work impact, both from pay and skill set.
Okay.
Yes. Yeah.
Thank you.
I know we're over time. I did want to give you an opportunity, since you were locked out, to ask a few questions, and then I think we will close out. So.
Hi, I'm John Bender, and I'm a family medicine physician. And my company has 65 employees. We are self-employed. 40 of our employees own the company. Last year, we had 10 pregnancies. I'm not kidding you, 1 in 6. We are self-funded for disability. And the reason for that is we used to buy disability through a traditional underwriter. And our HR director, when she applied for benefits, they had lost her application. They wouldn't pay the benefits. And I'm like, this is nuts. We could take better care of it if we just did it ourselves. So we've been self-funded for a number of years now. One of the reasons I like that is we pay the benefit back as a payroll payment. So if someone is out for 3 months, which is a fourth of the year on their maternity leave, we're basically paying them a paycheck. It's a little smaller than their full pay because we do want them to come back. They have to have some incentive to come back. And then we can also still do payroll deductions, like if they want their dental benefit because they don't want to lose their teeth benefit right while they're out, or if they're doing a legal plan or something else, you know, we take those out. Also, the ESOP benefits are paid out based on the amount of revenue or income you have received. So someone who earns more in the company gets a bigger share of the ESOP dividends. So my concern with the new program is that if my employees go on maternity leave next year, they're going to have to now file. And I'm concerned that it might be like the Department of Labor. And then if they go 2 or 3 weeks and it's not been approved, or if there's problems, because it is a new program, then they're going to be sitting at home without a paycheck when we would have just given one immediately. their dental, their vision, their legal plan, all the different benefits they're taking for the company that they pay a little bit portion of. I don't know how that gets paid for now. Do I pay it for them and then they have a loan, and then when they come back to work, they got a big loan to the company because the payment is coming directly now from the state to them. And then finally, if they are a vested owner in the ESOP, before they would have gotten 12 months of pay checks from us, and they would have been granted dividends allotments as part of their ownership. Now they're only going to get paychecks from me for 9 months, because the other 3 months they won't get a check, which means that effectively is going to reduce their IRA by about 25%. They're going to have a penalty, and I can't do that differently because that's all through federal law. So I think this is a great program. I'm in Colorado. I'm glad that everyone's going to have it. My company wants to opt out. And I think we've proven, because we've done it for 5 years, that we have a very strong benefit. I have no clue how to do that. It's 4 months till this goes live. I've called, I've looked online. It doesn't look like the infrastructure is fleshed out to do this easily. I spoke to the Chamber of Commerce president today, and she tells me, as far as she knows, no one has been approved yet for an opt-out. I'm concerned that only the big companies externally owned outside of our state are going to get this opt-out provision, that locally owned companies like mine, especially when it's owned by the actual receptionists and phlebotomists that work there, are going to have a really hard time because the bar will be set too high and I'll have to hire a bunch of expensive lawyers. I just want to know what the process is and what it would take for us to opt out.
Tracy's going to take this one.
Yeah, that's a lot to unpack, but let me do my best.
That's a good point.
First of all, I can tell you that our system for opting out and becoming a self-funded private plan employer is certainly available to you. Those resources are available online. You would need to submit that application and basically show us the plan that you have now, along with submitting a surety bond. We'll be able to get that reviewed for you. We're processing those every single day, and we do have some that have been approved so far. So that's certainly going to be an available option for you and for your practice members. If you decided to make the decision to participate in the state's plan, and you wish to pay your employees while we're coming to our adjudication decision, that's certainly something that's going to be an available option for you, in which case we will be able to initiate a process to send payments via you, as opposed to immediately to your employees. We do have David Gallivan on the line with us as well, who's one of our policy and legal experts too, who may be able to give you some additional insight. But basically, you're certainly welcome to apply for a self-funded private plan if that's the preference of your organization.
I would like to note that if you are searching on the website, it's not under opting out, it's under a private plan. So if you are searching, you're going to find a lot more information about applying for a private plan. There's also example like contracts and wording and things like that to hopefully help, especially small businesses. Yeah.
Thank you. Sorry you only joined us for the last 10 minutes. Apologies. We are going to wrap up. Just 2 items to note. We have 2 additional town halls. You can join those virtually if you were not able to ask your questions today. Those are on September 26th and October 16th. Information is available on our website to join those 2 remotely, or you can join us in person. One's Colorado Springs, the other way. Other direction from here in Denver. So thank you so much for joining us tonight. Feel free to use any of the contact mechanisms that we've displayed for you. The contact center is great. I do want to give a shout out. We do have one of our customer service reps in the back joining us. She lives in Fort Collins, but she's one of our employees in the contact. They're fabulous people. I had somebody recently say, I'd rather do anything but call a government contact center, but please note, this is the exception. They're very helpful and responsive and no wait times. So thank you again. Have a great night. Thanks.